The issue of abortion has been arousing big emotion and polarizing society for years. This phenomenon can be easily observed not only in Poland, but also among the entire international community. In recent years, many European countries have liberalized their abortion law, making it practically possible to kill an unborn child on demand. However, in June this year, European Parliament went much further and adopted a resolution according to which access to abortion is a human right. Such an interpretation inevitably leads to full legalization of abortion and its characterization as an ordinary, common medical procedure. This problem is therefore still relevant. Abortion advocates often argue that legal protection of the unborn children has a negative impact on mental health of women who are not able to kill their babies in the womb. Protecting these children, they argue, puts their mother at the risk of severe stress and even clinical conditions such as depression. This is particularly important since in many countries, mental health is the reason most commonly cited for abortion. That is why we would like to look at the issue of abortion from the perspective of its consequences for women's mental health. For this purpose, we invited experts in the area who are Professor Ewa Dmoch-Gajzlerska, obstetrician-gynecologist, head of the Gynecology and Obstetrics Department at Solec Hospital, editor-in-chief of the journal Midwife, Science and Practice. Dr. Calum Miller is a medical doctor, having graduated from Oxford Medical School with degrees in medical sciences. He is also a research associate in bioethics and philosophy of religion at the University of Oxford and provides tutorials for students at the university. His published research includes papers on the beginning of human life, the ethics of overseas medical electives, academic freedom, and the place of religion in psychiatric practice. Professor Patricia Casey is a professor of psychiatry in the Department of Adult Psychiatry at University College Dublin and consultant psychiatrist at Mater Misericordiae University Hospital. Her research interests include suicidal behavior and adjustment disorders. She's also a regular contributor to the media and writes a weekly column for the Irish Independent, Mind and Meaning. Dr. Dave Reardon is a director of the Elliot Institute and as associate scholar with the Charlotte Lussier Institute. He began researching the effects of abortion in the mid-1980s and subsequently received a PhD in biomedical ethics from Pacific Western University. His studies have been published in such medical journals as the British Medical Journal and the American Journal of Obstetrics and Gynecology. Now, I would like to kindly ask Dr. Miller to speak on this matter.
Thank you. Well, thank you for taking the time to listen to what we have to say. This will be a scientific and clinical discussion of these issues rather than a religious discussion or a philosophical discussion. And one of the reasons this is so important is because most of us, regardless of our position on abortion, whether we are pro-life or pro-choice or something else, most of us believe that both lives matter. There is importance to human life in the womb, and there is also immense importance, infinite importance, to the mother of that child. And often we are led to believe that we have to choose between them. We have to choose the mother's well-being or choose the child's well-being, and we can't do both. I want to challenge that through the use of science and the use of evidence today to suggest that actually the supposed mental health benefits of abortion for women do not seem to be evident in the academic literature. And actually, it seems that abortion has negative psychological consequences for women, according to the best evidence that we have. So most of us believe that both lives matter, and I want to suggest that we do not need to choose between them. We can treat humans equally. We can believe in human equality and the equality of a mother and a child, and treat them both with profound dignity and respect. So this is obviously immensely important because abortion in many parts of Europe and the rest of the world is so common. In my own country, the United Kingdom, there are over 200,000 abortions every year. And this means that 1 in 3 women in their lifetime will have an abortion. And most women who have an abortion in the UK will have more than 1 abortion. Worldwide, we don't know exactly how many abortions occur because it's very difficult to estimate abortion where it is illegal, and most estimates are unreliable. But we do know that there are tens of millions of abortions globally each year. Now, in the UK, a reason has to be given for obtaining an abortion. Abortion is not available on demand in the United Kingdom. And so what that means is that abortion is always given a documented reason. And in the UK, 98% of abortions out of those 200,000 are done for mental health reasons. Now, you would expect that there might be a diagnosis such as depression or suicidality or anxiety that leads to the abortion if the grounds are mental health. But in reality, almost all of these 98% of abortions are coded and documented as mental disorder not otherwise specified, a generic label that doesn't correspond to any known psychiatric condition. And what this means is, in effect, that abortion is available on demand because there are supposedly some mental health benefits, but no one is able to explain exactly what those benefits are. Now, there are certain risk factors for mental health consequences after abortion. So women, for example, who are particularly young, or who have a history of mental health problems, or who have an abortion later in pregnancy, are much more at risk for having negative psychiatric impacts after an abortion. And there are many other well-known and widely agreed risk factors for those negative outcomes. One that I want to talk about very briefly is coerced abortion. It's suspected that coerced abortion is actually reasonably common. So, for example, in various surveys and academic studies in a variety of countries across the world, both in Western countries and African countries and elsewhere, we find that about 1 in 5 or 1 in 4 women having an abortion will be forced to have that abortion by someone else, usually their male partner, but sometimes the doctor, sometimes the abortion provider, sometimes their parents, and so on. In the UK, we have even seen forced abortions on disabled women who want to keep their child. This was something we were assured would never ever happen. But just a couple of years ago, there was an attempt to force a woman who was disabled to have an abortion against her will, and the doctors tried to force it, the courts tried to force it, and it was only overturned by a higher court at the very last minute. Now, this is widely agreed by everyone to be a grave human rights violation, but it is what happens to some women in countries where abortion law is much more liberal or permissive. So coercion is a risk factor for mental health consequences after abortion. Women who are coerced or forced to have an abortion are much more likely to have mental health conditions afterwards, but there are many, many other risk factors as well. Now, as I say, mental health is the usual justification for abortion in many countries. 98% of abortions in the UK are done for mental health reasons. But we know that abortion providers try to interpret this as liberally as possible, so that it really means abortion on demand. For example, in the health guidelines for Ghana, which is a conservative, pro-life country that only allows abortion for health reasons, the Ministry of Health, in collaboration with abortion lobbyists, has suggested that no psychiatric assessment is required to obtain an abortion. They should simply look at the woman's emotional status in relationship to the pregnancy, i.e., if she does not want the child, she should be able to have an abortion on mental health grounds. And in fact, it's been shown by a legal feminist scholar from Oxford, who is pro-choice herself, that even sex-selective abortion is allowed under mental health grounds in the United Kingdom. And we know that that does occur in the United Kingdom as a mental health justification for an abortion. Now, the problem with this justification is that there is virtually no scientific evidence at all for it. David Ferguson was the leading authority in the world on these questions. He was a professor of psychology from New Zealand, a very progressive, pro-choice country, and he himself was pro-choice. He said that abortion should be legally available for any reason up until a certain point in pregnancy. But he said we have to look at the mental health question not as ideologues or as lobbyists or activists, but as scientists. And when he did that, he found that there was no evidence that abortion had mental health benefits. He says in one of his more recent papers before he passed away that at the present time there is no credible scientific evidence demonstrating that abortion has mental health benefits. As I say, David Ferguson was pro-choice, and he also was widely recognized as the best researcher in the world on this topic. He is not someone that can be easily dismissed as a pro-life activist. In fact, the idea that abortion doesn't have mental health benefits is reasonably uncontroversial within academia and within clinical medicine. The Royal College of Obstetricians and Gynaecologists in the UK, which is a very vehemently pro-abortion professional body, nevertheless says that women with an unintended pregnancy should be informed that they are no more or less likely to suffer adverse psychological sequelae, i.e. adverse psychological outcomes, whether they have an abortion or continue with the pregnancy and have the baby. Likewise, in one of the most famous recent studies in America, which has generally been supportive of abortion and has been carried out by a think tank which supports abortion access, they nevertheless have to conclude women who were denied abortions did not experience substantial negative psychological outcomes. In fact, they experienced comparatively few negative psychological outcomes, including no increased risk of depression, suicidality, or post-traumatic stress symptoms. What they are saying, in short, is that everyone agrees that if you are denied an abortion or if you keep the baby, you are not at any higher risk of mental health outcomes. And this is relatively uncontroversial. Now, there are a few other facts in this space which are relatively uncontroversial. For example, it is known that some women, even if only a minority, have abortion-specific post-traumatic stress disorder. Now, I don't want to get into the debate about post-abortion syndrome, about which I will say nothing at all, but we do know that some women after an abortion have post-traumatic stress disorder, and that a small minority of women have the disorder specifically relating to their abortion. We know that the large majority of women who have an abortion have significant negative feelings after their abortion, such as guilt or sorrow or sadness. We know that these negative feelings about an abortion increase over time, so that as time goes on, women feel worse about having their abortion, and so we need to follow women up much, much later and not only look at their initial relief at having an abortion. We know that multiple abortions are linked with a higher risk of anxiety, and very few people in the literature actually dispute this. We know, perhaps most remarkably, that for those women who were refused an abortion, who were denied an abortion because they were past the limit of that abortion provider, over 96% of those women ended up being glad that they were denied an abortion. By the time their child had their 5th birthday, at least 96% of those women were glad that they were denied the abortion and given the opportunity and support to have their child. We know that pregnancy and motherhood are protective factors, some of the most strong protective factors against suicide. And as I suggested earlier, it is widely agreed by all the main authorities on this topic that David Ferguson's work is the best quality work. Now, in talking about this, it is important not to exaggerate. I don't want to use, in fact, any studies that were performed or conducted by pro-life researchers. There's often a debate about ideology in academia, and I want to suggest that even if you completely ignore every study done by pro-life researchers and only look at studies by pro-choice and neutral researchers, you will still find clearly that abortion does have negative mental health outcomes. Just in 2008, the British Journal of Psychiatry, which is one of the leading psychiatry journals in the world, said that the fact that abortion is harmful for women's mental health was on its way to becoming an established fact of psychiatry. And this was based on David Ferguson's work in 2008. And later, David Ferguson decided to collate and collect all of the studies on this topic and look at the very best studies on abortion and mental health. And when you put all of them together, he found very clear trends. This is what he found. He found that there was a 28% increased risk of anxiety for women having an abortion compared to women who continued an unwanted pregnancy. He found that there was a 70% increased risk of suicidal behavior from having an abortion. There was a 134% increased risk of alcohol misuse and a nearly 300% increased risk of drug misuse. And as I say, this is someone who is pro-choice himself, but who was simply following the science and the evidence where it led him. Now, I want to highlight one particular condition because this is actually the leading cause of maternal death within a year of pregnancy in many developed countries. So it's known in the UK, for example, that maternal suicide is the second largest cause of direct maternal deaths within 6 weeks of the pregnancy. And within a year of the ending of the pregnancy, it is the leading cause of maternal death. But what's remarkable is that the suicide rate after abortion is many, many times higher than the suicide rate after delivering a pregnancy. Now, I should clarify for transparency that much of this increased risk is due to pre-existing factors. The fact that women having an abortion are in worse mental conditions to begin with. But nevertheless, even when you compare like-for-like women, and even when you keep all of those pre-existing factors constant, as David Ferguson showed, there's still a 70% increased risk of suicide from having an abortion. And so this seems to be directly linked and a causal effect of the abortion itself. As a result of the increased risk of suicide, the mortality rate after abortion is much, much higher than the mortality rate after continuing a pregnancy, as the graph very briefly shows. And if you want to know more about this, please do look at other work on this topic. But this work is from Finland by Karalis and her colleagues. What's most remarkable, perhaps, is that while pregnancy is becoming safer and safer over time, for example, over this study period in Finland, there was a 27% decrease in the mortality risk of pregnancy. Abortion is not becoming as significantly safer over time. There was only a 10% decrease in the mortality rate in abortion over the same period. And this is quite remarkable, particularly in a country like Poland, which has the lowest maternal mortality rate of any country in the world. So why are these conclusions not widely believed? Why do some people dispute some of what Ferguson found? Well, most people are agreed that his research is the best. But we do know, because David Ferguson told everyone afterwards, that he was asked not to publish his findings by his government because they would be politically harmful. We know that certain groups which conduct alternative research on this topic are politically motivated in favor of abortion rights, and they say that they are committed to abortion politically and ideologically. We know that many researchers who offer alternative theories and alternative conclusions refuse to release their data, and I have experienced that myself, with people not making their data available for scrutiny. We know that in academia, there is a significant bias against many conservative positions. Now, I don't want to say that being pro-life or being against abortion is necessarily a conservative position. In fact, the history of abortion is often linked with causes on the left wing, particularly in the US. It was primarily left-wing advocates in the early phase of the pro-life movement who were advocating for life. This is not necessarily a conservative or liberal issue. It is an issue about justice and about protecting the vulnerable. But we do know that there is significant bias against any position that is seen to be conservative, such as a pro-life position. And we know that some researchers very selectively present their data in ways that omit any data which seems to cast doubts on the benefits of abortion. Now, one thing you might say is that the reason abortion is linked with negative mental health outcomes is because abortion is stigmatized. And so if abortion were destigmatized, women would feel absolutely fine after having their abortion, and there would be no such causal relationship. But that seems implausible for a number of reasons. The first is that many of the best studies on this topic come from very, very liberal, progressive countries which are very supportive of abortion rights, such as Finland and New Zealand. Moreover, in one of the most recent major pro-abortion studies, the Turnaway study, they looked at women who were denied abortions and compared them with women who received abortions to see the difference in outcomes. And one of the things they studied was whether those women were protested against outside of a clinic in the United States. And what they found was that women who experienced protesters against abortion when they went to obtain their abortion had no impact on their mental health, even just 1 week after the abortion, let alone a lasting long-term effect of those abortion protesters. And so stigma doesn't seem to have a major effect on the mental health outcomes after abortion. And finally, in any case, even if stigma were responsible for the mental health outcomes after abortion, it is something that is virtually impossible to eliminate, because even in the most progressive pro-abortion countries, like the UK, most people have an unease about abortion and think that abortion should be restricted to certain conditions and to certain points within the pregnancy. Now, one claim that is commonly made is that most women who have an abortion experience no regret. And it's sometimes even claimed that the idea of anyone regretting their abortion is a myth. Now, of course, this is profoundly disrespectful to the women who courageously raise their voices to say that they regret their abortions. It simply eliminates these women from reality, and that is profoundly misogynistic. But actually, we do know that abortion regret is not as uncommon as it sometimes seems. The main study used for this is the Turnaway study, which says that 95% of women feel they made the right decision. And it is true that even several years after abortions, most women feel they made the right decision. However, we know that an even higher percentage of women who were denied abortions are glad that they kept the baby, or you might even want to say they were forced to keep the baby. Nevertheless, 96% of them were glad that abortion was not an option and that they ended up having a baby. Even within just 1 week after being refused an abortion, half of the women already felt that they were glad that they were refused an abortion. We know that although most women say they made the right decision, nevertheless, most women also say that they would not want to have another abortion ever again. We know that a significant minority, probably about 10% of women after a few years, feel that they made the wrong decision, and better quality studies show slightly higher percentages, around 10%. And we also know that feelings of regret can coexist with feeling that someone made the right decision. So many women feel that they made the right decision and also express feelings of regret about their abortion. The two can coexist at the same time. Now, finally, I just want to touch briefly on a topic that I know is very current in Poland due to the recent decision by the Constitutional Tribunal to limit abortion in the case of disabilities that the child is found to have. Now, I don't want to make any political or ideological statement about this or about the politics of it. I want to talk simply about the science and the empirical evidence relating to this. Now, there are many different kinds of disability. There are some disabilities which you might think are very mild and very easily correctable, such as a cleft lip or a cleft palate. And we know that in the UK, these abortions are legal up to birth for a cleft lip or a cleft palate, which is easily correctable. There are some conditions, however, which are much more serious and which do lead the child to passing away shortly after birth. And these, of course, are very tragic situations, and any woman facing this sort of situation absolutely deserves the utmost respect and compassion and care from the medical professionals, from the society around her, and from the people closest to her. No one is suggesting that this is an easy situation, but I do want to look at what the empirical evidence shows about it. Even in these most serious situations where many people, even many pro-life people, feel that they might want to make an exception and allow abortion in these harrowing and difficult circumstances, the empirical evidence doesn't actually suggest that this will help the woman psychologically. So, for example, in one very recent study of women who kept the child, even while knowing that the child would shortly pass away soon after birth, 97.5% of women in that position were glad that they kept the baby, and they had no regret whatsoever about keeping the baby, even though they knew it was going to pass away soon after birth. The study says that parents valued the baby as a part of their family, and they had opportunities to love, hold, meet, and cherish their child. Participants treasured the time together before and after the birth. Although emotionally difficult, parents articulated an empowering, transformative experience that lingers over time. Now, this is something that even many people who are pro-life would not expect. They would not expect that this is an experience which many women, most women, find to be profound and in some ways paradoxically joyful, and that is what the women say. But this is something that we have to listen to women's voices on. We cannot simply make assumptions for them and assume that they will react a certain way to these circumstances. In fact, women who keep the baby overwhelmingly say that they were glad that they did so. You might think this is only for religious people who can find some sort of religious meaning in these difficult circumstances. But actually, studies show that even for non-religious parents, they say the same.
Now I hear you again. The sound went out. Yeah, I'm switched to earphones so I don't hear my own echo though. Hang on just a second. Is there a way for me to share my screen? I can share a PowerPoint, or I can just discuss stuff. Okay, I'm assuming there's no way to share my screen. Can you hear me at all? Okay, so I guess I can't share my screen, so I will just discuss it. I think the presentation that was already presented, I'm still hearing my echo. Is there any way you guys can turn off? Maybe not. Maybe I'll just talk and assume you hear me. I'm hearing the echo of everything I said. The prior presentation, covered a lot of the major important points. Since I can't share my screen, I want to encourage people to look at, if you Google Reardon Abortion Controversy Review, I have like a 30 or more page review of the literature that's available through Sage Open Medicine. It's called the Abortion Mental Health Controversy, and I would strongly recommend people look at that. I think, as was previously mentioned, it's very important to look at the Ferguson papers and focus on the issue of coerced abortions. Legalization of abortion is a double-edged sword. It allows women who may want an abortion for their own purposes to get an abortion, but it also allows other people to pressure them into unwanted abortions. We have to remember that abortion and pregnancy is unique of all medical procedures, because it's not about just the health of the one person. There's a new life coming into the world, which can be perceived as a threat or a burden to the male partner, to parents, to employers, to others, to population controllers. It's very, we fail to realize often in the conversation about abortion that the push to legalize abortion was largely driven by eugenicists and population controllers who were concerned about trying to make abortion more accessible to low-income people, because abortion in older days, early in the 20th century, was primarily a abortion of a last pregnancy by women who were wealthier, more well-to-do, who had already had the number of children they wanted and were wanting to avoid having future children. And in any case, the demographics were clear that wealthier people were having fewer children and poor people were having more. And the concern among the wealthy, which drove a lot of population control efforts, was that, the poor are going to overtake us. They're going to want our wealth. Too many poor is drain on society. Nowadays, it might be framed in the context of excess births contribute to global warming and carbon imprint and all this. The point is that just because a woman's pregnant doesn't mean that she wants an abortion. She's getting a lot of feedback from other people saying they don't want her to bring that life into the world. One survey found that over 90% of women said they would have considered differently not having the abortion if they'd been receiving support from other people. So in many cases, women are feeling pressured by others to choose abortion. Even very recently, a study out of one of the leading pro-abortion groups in the United States, the found that only minority, I believe it was around 43% of women seeking abortion described their pregnancy as unwanted. The remainder described the pregnancy as either wanted or mistimed. And again, being mistimed means that the woman has some maternal connection to the pregnancy that she's about to abort, but she's aborting primarily because she's feeling pressured by others. And also should emphasize also the difference between coercion and pressure. In many cases, women are literally being pressured, threatened, pushed into unwanted abortions outright. Many other cases, they're simply being denied any support. The boyfriend may say, well, you can do what you want, but I don't want to have the pregnancy, or I don't want to have the baby. Even a mild amount of pressure can be determinative and lead a woman to have an abortion, even though it's not such overwhelming pressure that we could classify as coercion. She's feeling lack of support. She's feeling encouragement to have the abortion. In any case, these are risk factors for negative consequences after abortion. In fact, the American Psychological Association, in their literature review, where they basically tried to go through and say, well, all these studies have weaknesses, therefore we can't draw any conclusions. Even they identified about 15 risk factors that are predictive of negative psychological effects after abortion. They include terminating a pregnancy as wanted or meaningful. Now, wanted or meaningful, so as I mentioned before, a large percentage of women having abortions describe the abortion as the pregnancy as wanted or meaningful. There should be screening for all these things, but most abortion clinics don't. Again, that's part of the problem with just trying to describe abortion as a human right. Ignores the fact that abortion can be used as a weapon against human rights. It can be used to deny women of pregnancy that they want. It encourages sex trafficking problems because, again, women can be pressured into having unwanted abortion in order to keep them available as sex workers. But the second one of the other risk factors identified by the APA is perceived pressure from others to terminate pregnancy. I think that was well worded because whether or not they were actually being pressured by others or they just perceived that they were being pressured by others is a risk factor. And in a broader sense, I think you can say that any conflict of the woman's logical mind and her heart, even women who self-choose abortion with no pressure from others, if their immediate reaction to being pregnant is, ooh, I'm pregnant, and she's thinking of all of her fantasies as a little child someday having a baby, and she's connecting to that baby, and she's always thought abortion is wrong, but she's thinking logically, but I need to finish school, all these other things. If she is basically logically working her way through a way to ignore what her heart was telling her. I'm attached to this baby. I would love to have this baby. If only this were 2 years from now, if only we were, if she's thinking about if onlys, this would be great to have this baby. But logically, she decides to have the abortion. She is at risk because her heart and her mind are not really fully aligned. And I think that's one of the big problems, especially with parents coercing their daughters in unwanted abortions, is there's the myth. It's not even that widely stated, but people imagine that abortion is going to turn back the clock and your life will go on the way it was before you were pregnant. And parents who decide that their 14-year-old daughter who doesn't want to have the abortion, well, she doesn't know, she'll appreciate it later on that we made the best decision for her because we saved her career and her education and her opportunities. They imagine that abortion will just turn back the clock and it will go on, her life will go on the way it was. But that's not true. She's already experienced a life within her. She perceives herself as somebody who as a mother. In fact, I often tell people, I think most, especially women agree, especially those who've had a miscarriage or an abortion, that when you ask a woman how many children do you have, she'll say how many living children she has. But in her mind, she's thinking about the babies that were also miscarried or aborted because she is a mother to those two. Those are losses that she never raised those children, but on an emotional level, she still has a connection to. So just to run through some of the other risk factors, because I think these are extremely important. Perceived opposition to the abortion partner's family and or friends. So having people who are basically did not want to have an abortion. Lack of perceived social support from others, which is another broad category, but that includes lack of support for having the baby or having the abortion. Certain various personality traits they identify as low self-esteem, a pessimistic outlook, low perceived control over life. A history of mental health problems prior to the pregnancy, which I'll come back to. Feelings of stigma, perceived need for secrecy, exposure to anti-abortion picketing, use of avoidance or denial coping strategies. So a woman who tries to cope with her abortion by not thinking about it is at higher risk. Feelings of commitment to the pregnancy, ambivalence about the abortion decision, which includes a majority of women having abortions. Low perceived ability to cope with the abortion. So if a woman before the abortion, if you ask her, do you think you're going to be able to be fine after this abortion, or do you anticipate negative feelings? Those who anticipate negative feelings are more likely to have negative feelings. They're also less likely to participate in surveys after the abortion. So that's one reason causes the distortion in things like the Turnaway study. A history of prior abortion. In other words, even the APA admits that multiple abortions contribute to increased psychological risk. And we also know from a number of studies that a woman who has one abortion is more likely to have a second, third, or fourth abortions. And that's often because of risk-taking behavior, replacement pregnancy efforts where they're trying to become pregnant again to replace the lost pregnancy, but they face the same pressures or coercion they had the first time, and so they go through another abortion. Late-term abortions are at higher risk, again because of more bonding with pregnancy and perhaps some more intended pregnancies. In any case, there's all kinds of risk factors for psychological problems after abortion. As was mentioned, Ferguson himself, looking at all the data, says there's no mental health benefits to abortion. No literature at all showing benefits that women who have abortions in order to improve their mental health or in any reason. There's no study showing, for example, that women who have an abortion in order to keep their boyfriend, because the boyfriend says, you need to have that abortion or I'm breaking up with you. There's not a single study showing that they achieve those goals. There's no evidence that women achieve the goals they have at the time they are choosing to have the abortion. They don't keep their parents' self-esteem. They don't improve their mental health. They don't necessarily have better careers. There's no evidence of the benefits that women seek at the time of abortion. In fact, in many cases, we don't know what they're seeking because, of course, they're not really asking at the time of the abortion. So, as has been mentioned, there's literature showing that, and this is where the literature is very clear. If you look at all the studies, the risk of psychological problems after abortion are higher than the risk of psychological problems of women in general. Now, the abortion providers and the pro-abortionists have argued that that is only true because women who have abortions are more likely to have had pre-existing psychological problems after abortion. So their argument is that abortion does not cause, it's not the sole cause. In fact, APA, and you often see it kind of worded that way, is the argument that there's insufficient evidence to prove that abortion is ever the sole cause of psychological problems. But they can't deny, and they don't deny, that abortion can trigger pre-existing mental health issues and can exacerbate pre-existing mental health issues. So I think that's an important point that we need to emphasize in discussing the abortion and mental health issue, is that abortion there's no dispute that abortion can contribute to mental health issues. So there's also a lack of, the other side has not shown that abortion reduces the mental health issues once they exist. In fact, it's, again, as I indicated, it's likely very clear that abortion can contribute. A great example is, for example, cases of suicide where you have a suicide note from a woman who describes the abortion as having contributed to her death. In fact, she might even say it was the cause of her decision to commit suicide. Now, from a strictly scientific view, and I think that we probably agree, somebody who commits suicide after abortion, even after a couple abortions and leaves suicide note, we'd all agree that abortion contributed to that. It's hard to, for anybody to deny that abortion contributed to it. On the other hand, it would be hard for us to argue and prove that abortion is the sole cause of that suicide, because there's most often multiple factors in every human behavior, and in fact, perhaps most psychological conditions. It's not a single factor that impacts who we are, or how we feel, or how we experience things. So there's multiple factors. So I think my point is that, again, if you look at my review papers, I try to lay out that, look, there's no doubt that abortion is statistically associated with higher psychological problems. The only debate is whether how much of that is due to abortion itself. Pro-abortionists try to argue that it's up to critics to prove exactly how much and to prove that abortion is the sole cause of these psychological problems. I totally deny our responsibility to prove that's the sole cause. I think it's sufficient to have clear evidence that abortion is a contributing factor to psychological issues. As you saw in the statistics shown from Ferguson, the data is most strong. The studies which show the biggest effect are related to substance abuse. So women who have a history of abortion are much more likely to be using alcohol or drugs or some other substances to self-medicate. And again, at least some portion of these women had prior history of substance use. In one of our studies, though, the women themselves reported that substance use became worse after abortion than prior to abortion. So it's important for us to try to emphasize that abortion contributes to pre-existing mental health issues and can very possibly contribute to new mental health issues, even though that's arguably less clear because, again, it's hard to control for every prior psychological issue. I think it's impossible for people to argue that abortion is not, doesn't contribute to these issues, which is an important reason why there should be screening for all these pre-existing risk factors. Abortion providers should be obligated to screen for these risk factors, and I would argue they should be held responsible. Women should be able to sue for negative effects following abortion if the doctors did not do adequate pre-abortion screening. As was mentioned in England, my understanding in Great Britain, that it is the law actually requires that abortion can only be allowed when the risks of abortion are less than the risks of childbirth. The problem is that this is based on the doctor's good faith estimate of the literature. They don't have to actually be able to point to literature or any tests or whatever to determine that. So that's actually what bothered Ferguson. Ferguson, he was in favor when he wrote his paper, his review. Basically, it was very similar in New Zealand, and he thought it was ridiculous that doctors were prescribing abortions for mental health when there was not a single bit of evidence to justify making that recommendation. So he recommended, because he was pro-choice, he was like, well, we just need to get rid of the putting doctors in this awkward position of lying that abortion was going to benefit women's health. And he recommended that abortion should just be allowed based on request, irrespective of whether or not it was going to benefit women or not. So stepping back again, I think what's extremely important, especially in countries which face pressure to legalize abortion, would be that if it's going to be impossible to pass a law to prevent abortion, pro-lifers should begin to work to make sure that any abortions that are done will definitely benefit women, and any abortionist who does an abortion that doesn't benefit the woman is going to be held liable for the wrongful death of the baby and the harm to the women. And so that should be predicated on giving an explicit list of here's all the risk factors that need to be screened for. And if women have any of these risk factors, an abortion should be done. So that no abortion should take place when a woman is being pressured into an unwanted abortion. No abortion should take place if she still has ambivalent feelings, if she feels more conflict, more moral conflict, or maternal attachment to the pregnancy. Because then you're just you're cooperating with her in an act of self-destructive behavior. A woman who is aborting against her moral beliefs, against her maternal desires because she's being pressured by others is a terrible candidate for abortion, and that should never happen. I want to mention the rape and incest cases. We have a book called Victims and Victors, in which we collected testimonies from about 197 women who had rape or incest pregnancies. And the assumption that abortion is somehow going to cure the trauma following rape or incest is, again, there's no basis for it. In fact, our surveys found in another national survey in America of random population women where they asked about pregnancy losses and rape and incest, found that only about 50% of women who have a rape pregnancy would choose the rape pregnancy. And so most are more likely to carry to term. One of the things that we discovered in Victims and Victors as we gathered these testimonies is one of the main reasons women have abortions following rape is because of the pressure they face from other people to have an abortion. So if they find out they're pregnant, a month or two after the rape, their first reaction is one of confusion. A lot of them identify with the baby being a innocent victim also, and are afraid to become perpetrators of violence themselves. So it is not the first instinct of most women to choose an abortion after rape. They may have thought before they got raped that if I was raped, I was going to have it. But once they're past the trauma of the rape and they discover they're pregnant, they think that's a little differently. They're more confused. They're not necessarily oriented towards the rape. But when when the doctors, the families, others start saying, well, what are you going to do? If they even say, oh, I'm not sure, maybe I'll keep it, the immediate reaction is basically, well, maybe you weren't raped. So they begin to face pressure and suspicion and how could you keep it kind of attitude. So even the rape victims feel a lot of pressure to have an abortion because of the circumstances of their pregnancy. Now, certainly not easy for them. I'm not saying that any of them are happy and delighted. No, they're not. It's a very, very difficult situation. But especially in incest cases, the young girl who is pregnant from incest is most likely, according to the testimonies we collected from these women, she's most likely to see the pregnancy as a way out of the incest. It's a way to break free from the incest, even have her own family. In her mind, she's fantasizing how she's going to be a much better mother and protect her child much more than she was ever loved or protected by her parents. So the incest is always an issue of coercion, where the perpetrators are trying to cover up the crime. It's not something the girl is ever saying, oh, really, I want to have an abortion. I don't want to, So rape and incest, again, we got a number of things on our website, afterabortion.org, a number of articles from women and others on this. So I'd encourage you to take a look at the rape and incest cases. But the bottom line is the argument that abortion is necessary for rape and incest cases is largely an appeal to fear. It's an appeal to, oh, you wouldn't want to be raped or the victim of incest, so certainly you would want to have access to abortion. But if you actually talk to people who've actually been in the actual situation, abortion is not the first thing they want. It's not even what they generally want. And we are assuming that abortion is going to fix something, and it doesn't. It just adds to the trauma. Many women would describe, those who had the abortions, described how the abortion just added to the trauma. In some cases, they describe it as worse part of the trauma. So I think it's important to be prepared to discuss the so-called hard cases of rape, incest, and fetal anomaly, which was previously discussed. And again, all the literature shows that when there's problems with the pregnancy, with fetal defect, it is a very, abortion is not beneficial. In fact, it's linked with higher rates of divorce and other problems after the abortion. So it's not a solution to fetal anomalies at all. I think what you, well, here's another, I guess another thing I would highlight. So when you look at these various other reviews, for example, the American Psychological Association review in 2008, which I mentioned, identify these risk factors. Their conclusions are highly structured to kind of be misleading. The APA's press release and bottom line conclusions was that there's no credible evidence that a single elective abortion of an unwanted pregnancy in and of itself causes mental health problems for adult women. That statement is filled with a lot of nuances which people unfamiliar with the literature would not notice. That conclusion appeared as headlines, the headline being abortion does not have any mental health problems or whatever. So it's overly broad. But what the APA specifically was saying there's no credible evidence, is saying there is evidence, but we don't find it sufficient to prove that abortion is the sole cause of mental health problems. But they also say there's no credible evidence that a single abortion, which means they admit there's evidence that multiple abortions are risk factors, which in the United States, half of all abortions are for women who've had one or more previous abortions. Elective abortion means they admit that therapeutic abortions are associated with higher risks. Of an unwanted pregnancy, again, they're admitting that pregnancy intent or attitudes about pregnancy are a risk factor. So women who feel attached to the pregnancy are at higher risk of psychological problems. And they go on to say, in and of itself causes, means again saying that they admit that abortion can contribute to mental health problems, but there's insufficient evidence to prove that when and how often it's the sole cause of mental health problems. Then they say for adult women, which means they admit that for younger women, the risks are higher. So even the APA's very nuanced statement, when you parse it out, is an admission that for the minority of women having abortions today, there's insufficient evidence to abortion that shows that abortion is a high risk. So they admit that women have multiple problems, multiple abortions are higher risk. Women who are younger have higher risk. Women who are attached to pregnancy are higher risk. So the distortions that take place in the arguments about abortion are immense. Now, when the in the other review from Britain, I forget now, and it's very there was the task force, the British task force. I forget to be mentioned, but anyway, they in their review they decided to look at only 3 questions, and they narrowly limited those questions to produce results where they could basically say that, well, there's insufficient evidence to prove that abortion is the cause of the problem. What was again interesting is that in the history of sorry, I don't have all my notes clear here, but what's interesting is that the history of the literature review done out of Great Britain was that the original question was raised to the Royal College of Psychiatrists was exactly when does abortion benefit women's health? And they said, well, yeah, after the Ferguson thing, well, there's no clear evidence what that was. But the 3 questions that were addressed in the National Collaboration review, they didn't ask that question. Again, they avoided. In fact, I saw a review. They invited public comment on it, and in the public comments, I and others said, well, you should address the problem of when is abortion beneficial to women's health, and they decided to ignore that because there's no evidence for it. So it's very, abortion proponents, largely driven, I believe, not only by ideological views of women's right to choose, but by population control mentality and the desire to keep abortion available for the poor as a way to eliminate the poor are highly motivated to avoid any question that undermines widespread abortion. They are advocates for more abortions, not less abortions. In fact, again, and I've not even gone to this, but every study linking death certificates to abortion, and we did a literature review of that, which you also find. 11 studies that link death certificates to abortion, delivery, or miscarriage all show higher rates of death following abortion, both within the first year and over an extended period of time. So abortions associated with increased risk of suicide, deaths from accidents, which could be risk-taking behavior, deaths from natural causes, which we have a study coming out soon showing higher rates of cardiovascular disease after pregnancy loss. So psychological stress translates into physical stress, which translates into increased risk of death. And again, the other side has not disputed these studies at all, showing the association between abortion and a higher risk of mortality. Instead, they try to publish studies where they try to determine, well, here's the only causes we're going to consider, and it has to be within a certain period of time or whatever. But the argument that abortion is associated with lower risk of death is based on, not based on record linkage studies. It's always based on physician review, where they simply ignore deaths due to suicide. They're basically arguing that the risk of dying from a punctured uterus after an abortion is relatively low. If you ignore all other causes of death, they argue that abortion is safe. And that requires ignoring the literature. Since I can't share my screen with you, I will, I think, stop here and maybe just allow asking questions if I have any.
Okay, thank you very much for your time and for accepting my invitation. And now I would like to ask Professor Casey.
Now, I can hardly hear you. Can you hear me?
Yes, we hear you very well.
Thank you. Now, is somebody showing my slides? I understand I sent them. Okay, okay. Thank you for inviting me. I'm very grateful for Ordo Juris to ask me to participate in this meeting. I'm sorry I can't be with you in person, but I'm between holidays at the Edinburgh Festival and London, so I didn't want to run the risk of coming over because the COVID rules might change, the flight rules might change. The flights might be delayed, as they often are, and I might not have made it. So I'm doing this remotely, but I hope nothing freezes or the sound doesn't die. Can I have the first slide, please? Thank you. That's who I am. In fact, since I prepared that slide, I had thought I had changed it on the slide. I am no longer working at the Mater Hospital. I'm now at the Hermitage Hospital, but that's a small change. Can I have the next slide, please? Okay. Now, I'm a consultant psychiatrist and professor of psychiatry. Because of my work as a consultant, I treat patients. And I have treated a number of patients who have had abortions. In Ireland, abortion, a very liberal abortion law, very similar to the British one, was introduced became law in January 2019. And in the first year that it was enacted, after it was enacted, that's in 2019, there were 6,666 abortions in Ireland. That's a huge number. We have a population of just under 5 million. That's a huge number. And it was almost 3 times the rate that we had been getting from the time before that, when people were going to the UK and having abortions in England, Scotland, and Wales. So that would indicate a massive increase. The figures for 2020 were almost the same. There were 69 lower, so just over 6,000, but still a large number of babies lost their lives, unfortunately. I have not treated any women with post-abortion problems since the law was introduced in Ireland, but I do know that the Irish Family Planning Association have said that something like 25% of the women they counselled for abortion returned for post-abortion counselling. Now, one of the problems that I have seen among patients that have been referred to me in the past, and these were women, because it was before the law was enacted in Ireland, these were women who were going to the UK for abortions, and they would come back to Ireland, and then they would visit these counselling services, the family planning services, and say they were, suffering with distress of whatever sort, depression, guilt, anxiety, post-abortion. And they were always told, and I know this because several of them came to me afterwards, they were told, people don't get depressed after abortion. They maybe feel a bit upset for a very short time, but then it passes. And, you did the right thing, and they validate people, the decisions that women have made. They do not validate their grief or the trauma that they're experiencing. And by the time I saw them, some of them had clinical depression, they had suicidal ideation, some of them were very agitated and needed to be admitted to hospital, and so forth. So I have dealt with a number of women who far from getting helpful counselling, were dismissed, not of course in an unpleasant way, but were undermined certainly by what the counsellors trained in the area of post-abortion counselling and who support abortion said to them. I was also struck on a number of occasions by by third parties and the effect that the abortion had on third parties, like parents, siblings, or partners. And I'll always remember one lady whom I saw, that she was the mother of a woman who had an abortion, and she had really put pressure on her daughter to have an abortion, and told her that if she did not have an abortion, her daughter would have to leave home. So her daughter went to the UK and had an abortion and was devastated afterwards. But the woman herself, the mother herself, came to me because she herself then began to suffer mental health problems. And she felt extremely guilty at what she had done. She believed that she had advised her daughter wrongly. She accepted that she had put pressure on her, and she was deeply regretful about it. And we worked through that process with her. But she isn't the only one. I've had a number of third parties traumatized by abortion, and there is an increasing literature on the impact of abortion on third parties, more usually partners. Now, in my talk today, I'm not going to talk about that, but the two questions that I'm going to ask, the first is, does abortion harm women's mental health? And the second one, does abortion help women's mental health? Now, in dealing with these two questions, I will be overlapping with what both Calum and Dave have said before, so please forgive me, but I do think these are points worth reiterating and restating. So does abortion help women's mental health, or does it harm them? And as Dave said, the grounds for abortion in many countries, or the basis for abortion and for liberal legislation, is that it will help women's mental health. Women would otherwise be very distressed, their mental health would be harmed, and this is the only compassionate way to deal with the situation of an unwanted pregnancy. Can I have the next slide, please? Now, as you begin to examine that question, if you're a lay person out there and you don't know where the literature is found, the starting place is to look at the psychiatric textbooks, and in particular the textbooks that deal with perinatal psychiatry. Perinatal psychiatry is the branch of psychiatry that deals with all aspects of motherhood, like, you know, infertility, postnatal depression, puerperal psychosis, and much less abortion. Most perinatal psychiatrists, if you talk to them, will say to you there is no evidence of any harm from abortion, and so perinatal psychiatry disowns the study of abortion. The studies on the impact of abortion have been confined largely, apart from organizations like Professor Reardon's, have been concentrated completely in centers like the University of California, which receive funding from various radical pro-choice organizations like Planned Parenthood, the Warren Buffett Foundation, and such organizations. But perinatal psychiatrists, by and large, at least in the UK and presumably in Ireland, don't research it. But it's instructive to read the psychiatric textbooks on that, and I'll come back to that in a minute. The second way to go about it is to go to the scientific papers, to do Google Scholar searches or PubMed searches for scientific papers, and to draw on those. The problem with the scientific papers, as in any area of medicine, is that there are just so many of them. It's easy to get bogged down in them unless you're an expert in research methodology. It's very difficult to appreciate what are the good papers and what are the weak ones. And so you need guidance on that. And for that, we turn to what are called systematic reviews and meta-analyses. I'm going to talk about those a little later, but these are reviews of the literature that lay down criteria for the standards that any study should meet. So you might say there should have been a sample size of a certain amount. There should have been calculations to conduct, there should have been calculations to evaluate how big the sample size should be. They should have used valid measures of depression. They should have used valid measures of anxiety, and so on. When those high quality studies are identified by searching all the literature on the topic, you then narrow it down to the studies that are of the highest quality and that look at the areas that you are interested in. So in relation to abortion and whether abortion harms women, you would be looking at studies looking at abortion and the impact maybe on anxiety, on depression, on quality of life. So you would look at papers that use those measures and that measure them in high quality. And then you would combine those studies together, if possible, and analyze the data as a whole. If there were dissimilar studies in that you couldn't merge all the data because the methods, while good, were too dissimilar, you would write what's called a narrative systematic review. So we'll come back to that in a moment. Can you have the next slide, please? Okay, now the first book we are going to look at, and unfortunately the picture of myself is covering up of the slide, so I can't I can't see the complete name of the textbook, but hopefully the readers out there can, and it's something of perinatal psychiatric disorders, and it's a 2009 book. And this book, published by the Royal College of Psychiatrists Publication Company, has only 2 paragraphs on abortion, even though it's on termination of pregnancy, and even though it's on perinatal psychiatry. And on page 27, it discusses termination of pregnancy, and it says, most women will not be at risk of mental health problems post-abortion, but then it identifies a number of risk factors that both Calum and Dave have talked about, like the late abortions, the woman being coerced, the woman wanting the pregnancy. So, for example, this would be a pregnancy that was being carried out because of fetal anomaly. If the person having poor social supports, a prior history of mental health problems, being opposed to abortion, and a number of other risk factors. So that's all it does. It does not mention any psychiatric indications for abortion, which is a bit surprising, given that in the UK and indeed in Ireland, that is one of the grounds for abortion. Similarly, there is a chapter in seminars in liaison psychiatry by Guthrie, Rao and Temple, and a chapter in that on termination of pregnancy says women who request a termination of pregnancy and are referred to child protection services are other high risk groups and require extra vigilance and support. So that's a slight nod in the direction of possibly some women being at high risk who need extra vigilance and support. That's the only sentence about that. There is, again, no mention of the indications for abortion and no mention of specific harm like depression, anxiety, suicidal behavior, etc. Can I have the next slide, please? The next slide, again, my own head is covering the beginning of the title, unfortunately. It's by Lloyd and Guthrie, 2007. And there's a chapter written by Catherine Abel, and similarly another book, Seminars in General Adult Psychiatry by Stein and Wilkinson. There's a chapter on perinatal psychiatry and that, and neither mentions abortion in any way, shape or form, either in terms of possible harm or in terms of indications. Can I have another slide, please? Yes, can I have another slide, please? And finally, this is the biggest book in psychiatry. It's 2 volumes. It's like 2 volumes of a telephone directory, a British telephone directory. It's over 4,000 pages long. The index is 135 pages in itself. And there is a chapter on that, quite a lengthy chapter, slightly less than 30 pages, saying there are no adverse psychological effects, and there is no mention of psychiatric indications for abortion. Next slide, please. Okay, so far we have a number of mainstream textbooks in British psychiatry, and one American book, the SODOC one, which is used in the United States, among others, with no mention of psychiatric indications for abortion, and some making a slight nod in the direction of possible higher risk groups and adverse consequences, but only a gentle nod. So what is the relationship between abortion and mental health problems? And this is often debated between protagonists on both sides of the issue. One is that abortion causes mental health problems. In other words, that if you have an abortion, it is the abortion itself that causes the mental health problems. That tends to be the position of some pro-life people. Pro-choice people say that mental health problems are due to having conceived an unwanted pregnancy. And that is the position, obviously, of the pro-choice people. It's not the abortion, it's nothing else. It's having conceived an unwanted pregnancy, and that's why we need to get rid of it. And a third position is that abortion and its relationship to mental health problems are due to some other third intervening factor, like previous mental health problems, like partner violence, like poor social supports, and so on. And that is the middle of the road position. And I think for the majority of women who develop mental health problems, that is probably why they do. And we must remember that these intervening factors, like prior mental health problems, partner violence, coercion, poor social supports, are very common in the general population. So when the pro-choice people say these mental health problems are due only to unwanted pregnancy, they are ignoring all of these high risk factors that are present in very many of the general population. So if a woman, for example, has had a pregnancy in the past and has developed postnatal depression and says to you as a doctor, doctor, I think I would like to have an abortion because I've now got a pregnancy I don't want, and I would like to have an abortion to prevent that recurring again. The pro-choice person would say, yes, because the unwanted pregnancy has caused the problem, because you have an unwanted pregnancy and you're distressed about that, that will help prevent you from having a mental health problem again. On the other hand, I would say to them, no, this person is at risk anyway because they have had mental problems in the past, and that places them at risk of further mental health problems, whether or not they have an abortion. So, there is no winner in this. And in fact, the woman's mental health problem might be greater if she has an abortion, because she has to live with knowing that she ended a pregnancy that really isn't going to make any difference to the outcome. So these are the kinds of complex relationships that that some of the studies that have been mentioned have been trying to tease out. And I know coercion and partner violence have been mentioned before, as have prior mental health problems. Now, these are called confounders, and I will explain what a confounder is and why they're important. A confounder is something that might lead somebody to have an abortion, but might also cause a mental health problem. So, for example, a woman, I've given the example of the woman with a prior mental health problem following a previous pregnancy. She might, the abortion might, the previous mental health problem might cause her to seek an abortion, or it might cause her to have a recurrence of her depression following an abortion. So the same with partner violence. A woman might seek abortion because her partner is violent and putting pressure on her, and perhaps says to her, it will be okay if you get rid of this baby, I'll work on our relationship. But on the other hand, having her partner violence and the coercion may force her into an abortion that she doesn't want, causing mental health problems. So the two are related. There's a similar causal factor for both. And these confounders cloud the picture, and they certainly do that in this debate. Can I have the next slide, please? So now again, I can't see all of this slide because my photograph is my picture is covering it, and it's not the picture that has just been turned off. It's the actual picture from my own camera. Let me know, and I blanket, and it doesn't make any difference. Okay. The problem is that the studies in relation to mental health and abortion have shown mixed results. Clearly, today you will have seen and had discussion of the work of David Ferguson and other similar studies that have shown that there is a risk. You will have heard about other studies like the Turnaway study that have shown, well, not even the Turnaway study, that doesn't. There are some by Steinberg, I don't know if they were mentioned or not, that show that there are no adverse consequences to abortion. So, as I say, one of the approaches to get round the myriad of studies and the fact that some find evidence of harm and some find no evidence of harm is to combine the highest quality studies while controlling for the relevant confounders, the relevant factors that cloud the matters. And you can control for that in the statistical analysis. And this is what happened in the largest study of abortion that has ever been carried out. And that was a meta-analysis published in 2011 by the Medical Royal Colleges in the UK. It was headed by the Royal College of Psychiatrists. And then that data was taken and reanalyzed by David Ferguson in 2013. And he came up with a slightly different answer from the findings of the Medical Royal Colleges. Can I have the next slide, please? Nevertheless, the Medical Royal Colleges study is one that I think could be used more frequently and should be used more frequently when challenging the narrative that abortion is necessary in order to preserve women's mental health. What this systematic review did was they took all of the high quality studies and they gathered hundreds of them, and they excluded those that didn't control for enough variables. And they were interested in particular prior mental health and the wantedness of the pregnancy. So provided the studies controlled for those two, and indeed most of the studies, in fact all of the studies that controlled for these two, controlled for other variables as well, like the age of the woman, the number of prior abortions, and so on. And there were 4 studies that controlled specifically for the person's prior mental health and for the wantedness of the pregnancy. And the studies were Gilchrist in 1996. That was a study conducted in general practice in England and Scotland. Kugel and Steinberg were both US studies, and Ferguson was a New Zealand study. And the Ferguson study differs from the others in that these 3 were specifically in themselves focused on abortion, whereas Ferguson's study was a lifetime study beginning in 1980 with a cohort of people born in Dunedin in New Zealand and followed through for 35 years by Ferguson. And questions in relation to abortion were added in halfway through or thereabouts in order to examine that question. So it was a study that generated a lot more information about other aspects like cannabis use, like partner violence, like alcohol misuse and smoking habits, and a lot of other variables. And this study was, these four were examined by the Medical Royal Colleges, and what they found was that if if you controlled for prior mental health, none of these studies found any mental health problems. But if prior mental health was not statistically controlled for, then the rate would increase after abortion. So in other words, if somebody has a prior mental health problem and they have an abortion, their risk of suffering another one following an abortion is much increased. And that's a very important piece of information to give women who may be seeking abortions. They also found that there was no evidence whether women had abortion or went on to give birth to an unwanted pregnancy. There was no evidence that having an abortion protected their mental health. So abortion was of no benefit. If you didn't control for prior mental health problems, an abortion increased your risk of mental health problems. If you controlled for prior mental health, there was no difference. Can I have the next slide, please? So Ferguson disagreed with some of that in that he felt that the data suggested that perhaps even if you controlled for prior controlled for prior mental health problems and they found none, that the data suggested that there might still be a small risk of mental health problems. So he conducted a slightly different analysis using different tools, and he added he took the 2011 one from the UK, and he also added the Priscilla Coleman study in 2011, and he went through all of the same exercise with them in identifying the studies of highest quality, and he found that there was an increase in anxiety, depression, alcohol misuse, illicit substance misuse, and suicidal behavior. Suicidal behavior would include suicidal thoughts and self-harm acts, suicidal acts like self-harm acts. Can I have the next slide, please? So he found that there was consistent but small evidence associated with a reduction with I can't see the first, I have to leave out this first sentence because I cannot read it there. He found, because my own screen is overlapping with it, he found that abortion was associated with a small to moderate increase in the risk of everything we already mentioned except depression. A risk in anxiety, alcohol misuse, illicit drug use, and suicidal behavior. So he concluded that there was no evidence that abortion had therapeutic effects in reducing the mental health risks of unwanted or unintended pregnancies, contrary to what the law was saying. But there is suggestive evidence that abortion may be associated with a small to moderate increase in the risk of some mental health problems. Can I have the next slide, please? And as we've all emphasized, David Ferguson was not a pro-life activist, quite the opposite. He was pro-choice, but he believed that we should look at the data and not at ideology. He wrote a piece in a journal called the Psychiatric Bulletin that I edited at the time, and he said that in the UK, in the region of 94% of abortions are conducted on the grounds that continuance of the pregnancy would pose a risk to the mental health of the mother. By the way, it's the same in New Zealand. They have very similar grounds. He made that point later in the paper. He went on to say, however, to provide such a justification requires strong evidence showing that the mental health risks of unwanted childbirth outweigh the mental health risks of abortion. So you need to show that the mental health risks of giving birth outweigh the mental health risks of abortion in order to justify the ground. And he went on to say, although decisions on whether to proceed with induced abortion are made on the basis of clinical assessments of the extent to which pregnancy poses a risk to maternal mental health, these clinical assessments are not currently supported by evidence, by population level evidence showing the provision of abortion reduces mental health risks for women having an unwanted pregnancy. So indeed, what he's saying is abortion on the grounds of mental health dangers or risks are not evidence-based, and evidence-based practices are very much de rigueur in modern medicine. But in the procedure, the surgical procedure that's most common worldwide, it is not evidence-based. Can I have the next slide, please? The Turnaway study has been mentioned, and the Turnaway study was an American study from 30 abortion facilities in the US. And again, I can't see the beginning of the slide, but they selected women who had just had an abortion, and the women were followed up for the first 1 week after the abortion, and then every 6 months thereafter for 5 years. The interviews were telephone interviews. They measured anxiety, depression, self-esteem, and life satisfaction. They invited over 3,000 people to participate from these abortion facilities around the US. Slightly less than half agreed. These were women who had just had abortions. 90 of the total number invited, 956 were interviewed by telephone, that represent and at baseline, and by the time they had gotten to 5 years, the numbers had reduced to 558. Now these numbers are quite important. So this number, 558, represents 17% of the total number invited. So 17% of the number invited is a tiny, tiny minority, and they are likely to be highly unrepresentative of people having abortions. And one of the reasons for such a large attrition may well be that the people who dropped out are those who have been traumatized in some way by the abortion. The number interviewed at 5 years represents 42% of those who agreed to be interviewed. So the 17% refers to the proportion of the number invited, the 42% the proportion of those who agreed to participate. So the representativeness of the sample is certainly called into question in this. And the reason this study is important was because if you believe that abortion is beneficial to women's health, it means that if you're refused an abortion, your mental health will decline. So what did this study find? And can I have the next slide, please? It interviewed 3 groups. or it divided them into three groups. It divided them into those who had abortions near the gestational limit in that state. So these were women who had an abortion late in pregnancy. The first trimester group were a group who had an abortion in the first trimester, and the turnaway group were those who were turned away, who were refused an abortion in the first instance. Now, a number of those went to other states to get an abortion because the gestational age varies across states in the US. But interestingly, 163 of the 231 of the turnaways gave birth. So they were turned away and they gave birth. And a smaller group either had a miscarriage or an abortion of the turnaway group. And can I have the next slide, please? And what they found was that the group who were turned away, but who later had an abortion, were the group who experienced anxiety and low self-esteem. But they only experienced that in the early weeks post-abortion. The rest of the turnaway group, in that group, the group who had the anxiety and depression, it improved over time, and there were no long-term consequences. But in addition, the people who were turned away and chose to give birth did not have any long-term mental health consequences. And as I've said, 2/3 of those refused in the turnaway study actually gave birth. Can I have the next slide, please? So this shows that even when people who want an abortion are turned away, they do not develop any mental health problems, and the majority of them give birth to children. And indeed, Calum in his talk presented data suggesting that most people were very pleased that they had given birth 5 years when they were tracked down, when they were followed up for 5 years. The British Pregnancy Advisory website talks about applying the mental health ground in practice, and it says, the construction of the British abortion law presents a problem for women and doctors. It is not the case that the majority of women seeking abortion are necessarily at risk of damaging their mental health if they continue the pregnancy, but it is significant that because of the law, women and their doctors have to indicate that this is the case. In general, the national statistics do not and cannot reflect the real reasons why abortions are considered necessary. This can only reflect the grounds that are sought to make them lawful. So the first part of this is saying that basically doctors are making it up so as to meet the needs of their patients for an abortion. And can I have the next slide, please? Conclusion. The psychiatric textbooks and perinatal psychiatric textbooks do not detail any psychiatric indications for abortion. And I showed that, I discussed that in the first few slides. As I said, most of them made, well, not most of them, 2 of them gave a nod in the direction of possible mental health problems and vulnerability. None of them showed that there was any indication. There was, from the systematic reviews, the Royal College one in particular, there was no evidence of benefit to mental health or that abortion reduced the risks from mental health problems. David Ferguson also confirmed that in his reappraisal study published in the Australia and New Zealand Journal in 2013. He found some evidence of harm, and in particular for substance misuse, suicidal behaviour, and to a lesser extent anxiety. He did not find an increase in the risk of depression, which surprised me, I have to say. In relation to being refused abortion, the only group of the turnaway group who refused abortion, the group who had the highest level of mental health problems were the turnaway group who afterwards did not give birth and otherwise either had a miscarriage or went on to seek an abortion. And in those that did develop problems, the adverse effects of the refused abortion, in those refused the abortion, were short-lived. Thank you very much indeed for listening to me.
Thank you very much, Professor Casey. It was really interesting. And now I would like to ask Professor Dmoch-Gajzlerska to give her speech.
I would like to tell a few words in Polish language, so for that. But English is not my mother language, and it will be easier for me to speak in Polish. Dziękuję bardzo za te wspaniałe wykłady. Państwo jesteście niesamowici. Ten problem
I would like to thank you very much for these wonderful lectures.
Dla mnie, ginekologa położnika, przedstawiony tutaj w taki
For me as
sposób
an obstetrician-gynecologist, the data you presented here is
nową
absolutely
sytuacją, która jest bardzo
I must
istotna
admit,
w położnictwie i ginekologii
has a
w
real
Polsce.
in gynecology and obstetrician in Poland.
Z jakich przyczyn dokonuje się aborcja,
But
bez
regardless
względu na to, kiedy ma
of the
miejsce,
reason,
to nie pozostaje
regardless of
ona
the
bez
path
wpływu na
when
zdrowie
it takes
kobiety,
place,
zarówno fizyczne, jak i psychiczne.
it is not
I
without
tutaj ja w tym swoim
effect or
wystąpieniu
physical health of
chciałabym
the woman.
odwrócić
In
pewną
my speech, I would like
sytuację,
to
mianowicie chciałabym
reverse a certain situation, namely
wskazać, jak konsekwencje fizyczne
point
aborcji
to
mogą
how
wpływać
physical
na
consequences of
psychikę.
abortion
Mówię
might
tutaj nie tylko o skutkach pierwotnych, ale również o skutkach
I don't mean
odległych.
the initial
Przede
effects,
wszystkim
but also
my
the
wiemy,
long-term
że
effects.
statystyki, które są podawane,
First of all,
wskazują
that
na
the
to, że
statistics
przerwanie
that are
pierwszej
presented
ciąży prowadzi do częstych poronień
suggest
samoistnych, to jest
that
około
termination of the
38% i porodów
first
przedwczesnych, to jest
in
około
38 cases
4%. Może
leads to
również
premature
prowadzić do
birth
niepłodności
or
wtórnej.
miscarriages.
Ta niepłodność
It
wtórna
might also lead
jest czymś,
to
co
fertility,
kobiety w jakimś stopniu
which is something that women to a certain extent
bardzo utrudnia im życie,
which
dlatego
makes it
że
much more
wtedy
difficult for them
właśnie
just
przy
to
tej
live,
niemocy
to carry on
fizycznej,
living
niemocy
normally.
posiadania
Because
dziecka
when they
zaczyna
are physically a
zaczyna
child,
się cofanie do przeszłości i wtedy być
they
może
are coming back to the
zaczynają się
past.
te
This is the
problemy
moment
mentalne,
when very
problemy psychiczne. My
often
tego do końca
might
nie wiemy, tak jak
arise
Państwo
on the
podkreślaliście w
basis
swoich
of an abortion
wystąpieniach,
that had taken
że
place
ważne
years
są
ago.
badania
We do not know it
naukowe.
for
Ważne
sure,
jest
as
to, żebyśmy
have
przeprowadzili
we
takie
do not
badania,
have
które nam wskażą, na
sufficient
ile aborcja
scientific
ma
analysis,
wpływ
research for that.
na
To prove
mentalność kobiet,
it
na w jaki sposób powoduje
to analyze it
psychologiczne
sufficiently.
skutki
How does
aborcji.
abortion influence the
Oczywiście
mental
ja
state of
jestem ginekologiem, ponieważ
woman
z
long term,
dużym doświadczeniem,
as a
40-letnim prawie,
gynecologist with
to
over 40 years
chciałabym zwrócić
almost 40
uwagę
years
na fakt,
experience,
że
I'd like to
to, co dokonuje się dzisiaj w sferze aborcji, wygląda zdecydowanie
what
inaczej
is
niż te
happening
40
today
lat
in
temu,
terms of abortion
kiedy nie
is
było
something completely
nowoczesnych
different than,
metod
say, 40 years
diagnostycznych,
ago,
kiedy nie było USG,
within
kiedy
modern
traktowany
diagnostic
był zarodek
methods,
jako zlepek komórek,
ultrasonographic
gdzie dokonywano często
analysis,
aborcji
when the embryo
drogą
was treated
znieczulenia miejscowego poprzez rozszerzanie szyjki i poprzez wyłyżeczkowanie jamy macicy. Dzisiaj ta aborcja wygląda inaczej, bo mamy dwa sposoby, farmakologiczną i interwencję chirurgiczną. Oczywiście my, ginekolodzy, położnicy, zawsze musimy się liczyć z ryzykiem przebicia macicy, z ryzykiem tego, co nastąpi potem, a więc wzrostu wewnątrzmacicznych, które blokują potem możliwość zajścia w ciążę, jak również donoszenia ciąży, możliwość, o czym się bardzo rzadko mówi, ciąży ektopowej, która umiejscawia się w jajowodzie, co w konsekwencji powoduje to, że dochodzi do usunięcia jajowodu, jednego, drugiego i potem zaczyna się walka o dziecko, o ciążę, lata uciekają, jest to 8-10 lat w związku i okazuje się, że nie ma szans na to, żeby urodzić dziecko.
It turns out to be possible because of the abortion that they had taken.
Próba nie zawsze się udaje. Mam pacjentki, które po 4-10 razy próbowały zachodzić w ciążę, było to
I've had patients who tried IVF 4 to 10 times without effect.
Na
So the
kanwie
problem
tego problemu fizycznego pojawia się problem
and on the basis of the physical
psychologiczny, problem
also experience
psychiczny. Ja tutaj zwracam uwagę na to, że nie zawsze psycholog daje sobie radę z rozwiązaniem problemu. Często taka pacjentka wymaga wsparcia psychiatry.
Very often such a patient needs
Oczywiście skutki psychiczne są znane od 1981 roku, kiedy psycholog Vincent Roux stworzył pojęcie post-abortion syndrome, czyli zespołu poaborcyjnego, wskazując właśnie na te skutki psychologiczne. Ale równocześnie trzeba pamiętać, że to zagrożenie psychiczne według niektórych badaczy było zdecydowanie mniejsze, jeżeli aborcja dotyczyła pierwszego trymestru ciąży, aniżeli dalszych trymestrów. Czyli drugi, trzeci, najczęściej drugi i trzeci, to w Polsce przed orzeczeniem Trybunału Konstytucyjnego to były wtedy dokonywane w drugim trymestrze aborcje, kiedy była letalna wada płodu. Oczywiście niektórzy psychiatrzy, tak jak Państwo wspominaliście tutaj w swoich wystąpieniach, uważają, że mniejsze jest ryzyko przerwania ciąży, aniżeli kontynuacja niechcianej ciąży. Ale w konsekwencji dalszych badań, szczególnie w badaniach profesora Fergusona, okazuje się, że ta kontynuacja niechcianej ciąży wcale nie jest taka zła. Wcale te kobiety nie mają żadnych problemów z zaakceptowaniem dziecka. Ja bym chciała jeszcze zwrócić uwagę na badania chińskie, które były przeprowadzone, co prawda w latach 87-94, pokazały, że odsetek samobójstw kobiet, które dokonały aborcji, był dwukrotnie wyższy.
Among women who had abortion was twice as high.
18% i 6-krotnie wyższy od samobójstw po udanym porodzie.
And 6 times larger than after birth.
Polska psycholog Dorota Drozdowska-Szymborska zwróciła uwagę, że aborcja pozostawia ślad w psychice kobiety, bez względu na to, jakie przyczyny i okoliczności jej towarzyszyły. Na pewno pojawia się zespół straty po usuniętym zarodku. My kiedyś w klinice prowadziliśmy takie badania u pacjentek, które miały terminację ciąży w drugim trymestrze. Cóż się okazało? Okazało się, że 90% z tych pacjentek miało poczucie straty, miało zaburzenia nie tyle osobowości, co miały zaburzenia
some
mentalne,
disorders, maybe not personal disorders,
spowodowane
but mental
czym?
disorders.
Przede wszystkim tym, że zostały nakłonione do aborcji i najczęściej
That they had
był
been
to mąż bądź
coerced,
partner, ale
forced by the
taką
partner,
osobą, która miała ogromny
husband,
wpływ na
but also
dokonanie
a
aborcji,
person
był
who
kto?
was quite a
Teściowa.
great influence. was
Teściowa
the mother-in-law.
niemalże stawiała warunki, w jaki sposób
In most cases,
należy
it was that the mother-in-law
ukończyć
who,
tę ciążę. To zresztą było widoczne
who gave conditions
w czasie pobytu tych
how this
pacjentów
is terminated.
w szpitalu. Również to dokonywanie aborcji pod wpływem presji to może prowadzić
Also,
do,
tends
naszym
to
zdaniem,
lead,
w tych naszych badaniach,
in
do
our opinion,
późniejszej
according to our
depresji.
research,
Oczywiście matka dziecka, kobieta, będzie zawsze
of course, the child's mother, the woman will always be
matka dziecka kobietą będzie zawsze i do niej należy
she
wybór,
always remain a woman,
czy chce
and
być
she
matką
has
dziecka
to choose
żywego, czy
whether she
martwego.
wants
Na tym polega różnica
to be the
między
mother of
wyborem.
child or of a living
Czy
child.
poddaje się aborcji,
That's
czy
the
rodzi
choice.
dziecko.
Whether she refers to abortion or not.
Przepraszam za radykalne
Or gives
słowa,
birth.
ale tak jest. Nie da
Excuse
się
me, the
wymazać
very
gumką
radical
psychoterapii.
language.
Tutaj
You cannot
niczego nie
rubber out,
wymarzymy.
erase abortion.
Zostaje to w
from
pamięci,
memory.
zostaje to w,
It will remain forever in the woman's
kobiecie
memory.
do praktycznie, trudno powiedzieć do końca jej dni, ale najczęściej te wszystkie
I don't know if
objawy
until the end of her life, but for
związane
many,
z
many
traumą
years,
po
without
aborcji
doubt,
pojawiają się kiedy? W okresie klimakterium, w
all these
okresie
symptoms
okołomenopauzalnym.
are very strongly
Myślę, że
heard
tutaj w tej
more as in
kwestii
the age of
powinny być
climaterium,
przeprowadzone badania,
when she
dlaczego tak się
becomes
dzieje.
no longer.
Dlatego
And I
myślę,
think
że
there
ta
is a
gra
need for
hormonalna
research
zaczyna
in this respect.
zanikać. W
I
związku
think this
z
is
tym
when the
kobieta,
hormones are
większość kobiet
less,
przestaje się
less,
czuć,
many women
nie
undergo
tyle
through a certain
kobietą, co
crisis.
przestaje czuć to,
They
że
are
mogłaby jeszcze
kind of the way
zostać matką. I zaczyna
that they
zaczyna się
but
odnawiać
they are
ten
wondering
problem,
about the
zaczyna
fact
się cofać
why
do przeszłości,
hadn't I become a
zaczyna się
mother?
liczenie
They are
lat, jakie
tracing back
mogłoby
their
być,
past, counting
jakie mogłoby mieć
the
jej
years
własne
of this child.
dziecko. Oczywiście
And this might be very difficult for many of them.
skutki aborcji są w zasadzie medycznie ostrzeżeniem. My często tego nie zauważamy,
Of course,
ale
the health
natura nie
effects of
wybacza
abortion
nigdy. I w tej
are an
naturze
important
tak się
consequence.
dzieje, niezależnie od poglądów
Forgive.
naszych
Sorry to
religijnych
say that. Regardless of the views you might have,
czy
regardless of your opinions,
zdecydowanie laickich, każda z kobiet bardzo
whether you are pro-life or
odczuwa
pro-choice, every woman
te
feels
traumatyczne
very strongly
sytuacje, które ich dotykają.
traumas that
Dlatego
she
też
had experienced before.
częściej powinniśmy robić badania, jeżeli już chcemy zobaczyć,
That's why very
co ma wpływ na
often
psychikę
analysis of
kobiety.
such situations.
Ja zwracam
If you want to
uwagę na to,
analyze
czy
what
kobieta jest
influences
w
the
związku
woman's state of
formalnym, czy
mind,
nieformalnym, czy małżeńskim,
whether
czy
her
doświadczała już
relationship
ze
is formal or
strony
not, whether she's
męża
married
bądź
or not,
partnera fizycznego nadużycia,
whether she had
bądź psychicznego. To wszystko ma ogromne
experienced
znaczenie.
some kind of
Dlaczego my nie
mistreatment,
traktujemy
mental or
problemu
physical or
aborcji
emotional from her partner
interdyscyplinarnie?
before.
W zasadzie
We do not treat the
dzisiaj,
problem
słuchając Państwa,
of
przyszło mi do
abortion in
głowy
I think that's the
coś
problem.
takiego, że
And
warto
listening
by
to you
stworzyć
today, I have thought that
taką
perhaps
publikację,
we should
publikację bądź może
create a
książkę,
publication
broszurę, która by się nazywała
or a
Aborcja
book, I don't know, a brochure,
interdyscyplinarnie. I tutaj byśmy
an
spróbowali
interdisciplinary
poszukać
approach to abortion.
różnych czynników,
And
które wpływają
Jesus,
właśnie
to
na
analyze all
kobietę
the
wtedy, kiedy
all the factors that
decyduje
influence
się
the woman's
bądź nie dokonać
situation
aborcji.
when she decides to have an abortion.
Wydaje się też, że za mało
Well, I believe, of course,
zwracamy
not have,
uwagi na
enough attention
na te państwo psychiatrzy, psychologowie na pewno tak, ale my, ginekolodzy, położnicy, na te dwa zespoły, które się mogą pojawić po aborcji, a więc ten post-abortion distress, i który pojawia się w miarę wcześnie i w zasadzie jest taki przez większość ginekologów niezauważany, chociaż kobieta usiłuje dawać sygnały, że coś się z nią dzieje. Czasami one mają problem z tym do pół roku, czasami do roku. I to są te reakcje takie troszeczkę odroczone, ale w krótkim czasie po aborcji. To poczucie wielkiej straty, zarówno straty roli rodzicielskiej, zaburzenia obrazu siebie, zaburzenia snu, utraty celu życia, to są takie sytuacje, które bardzo wpływają na psychikę. Ja kiedyś robiłam taką konferencję, którą zatytułowałam Utracone narodziny, przegrane narodziny, utracone narodziny, i muszę powiedzieć, że tutaj w ten wątek wplatały się nie tylko doznania kobiet, które dokonały aborcji, tych, które straciły dziecko, ale również wplatały się doznania mężczyzn, partnerów, mężów, którzy wcale nie w sposób słabszy przeżywali to wszystko, co się działo z ich dzieckiem, z ich partnerkami czy żonami. To wyjście z tego psychicznego doła rozwiązywali w ten sposób. Część z nich zaczęła grać na instrumentach, część zaczęła pisać wiersze, część opowiadania i każdy wątek tych opowiadań, bo oni przedstawiali to na tej konferencji, wiązał się z tym utraconym dzieckiem, utraconym zarodkiem czy utraconym życiem. Także mężczyźni są też w tym względzie bardzo, bardzo wrażliwi. Oczywiście myślę, że w naturalnej śmierci dziecka, jeżeli się zdarzy poród, gdzie dziecko umiera, bądź też ciąża, w której doszło do obumarcia wewnątrzmacicznego i dziecko się rodzi, to oczywiście matka może rozładować te bolesne i trudne emocje. Zdecydowanie jej łatwiej, aniżeli w przypadku przerwania ciąży. Tutaj do rozładowania tych emocji nie dochodzi. Badania, natknęłam się na takie badania wśród studentów w Stanach Zjednoczonych, które pozwoliły zauważyć, że stygmat aborcji występuje nie tylko u kobiet, ale także u ojców i dzieci. Czyli potwierdza się to, co myśmy odkryli w czasie tych paneli na naszej konferencji. Kiedy są ci ojcowie szczególnie nieszczęśliwi? To jest następny wątek, który powinien być badany. Wtedy, kiedy ojcowie doznają straty, bo ich partnerki czy żony zdecydowały się wbrew ich woli na aborcję. To jest bardzo myślę, że istotny problem, dlatego powinniśmy, podchodząc do aborcji, naprawdę potraktować to wieloaspektowo i w różnych obszarach. Teraz kolejna rzecz, która nie jest do końca, może chyba, nie wiem, czy ktoś dotknął tego tematu. Jaki wpływ ma aborcja na rodzeństwo, które już jest, które jest starsze, które oczekuje nowego członka rodziny i nagle okazuje się, że tego nowego członka rodziny nie ma. Czy to będzie miało wpływ później, jeżeli jest to dziewczynka młoda, na jej psychikę, czy ona później zareaguje
For
na
example,
to,
if it's a small
że
girl,
jednak
it's going to influence
stało
her
się
thinking
inaczej, aniżeli
that
cała rodzina planowała.
she will look to this child.
Pojawić się może, tak niektórzy psychologowie mówią,
Possibly.
lęk
That's what some
przed własną
psychologists
matką.
say.
Po tym, kiedy
Fear
dowiedziały
against
się
their own
dzieci o
mother
przerwaniu ciąży. I teraz
after they had learned of
my
abortion.
zwykle nie informujemy, dzieci nie są informowane przez rodziców
Very
o
often we
tej
don't
sytuacji,
inform
ale
children
czasami
of
jest
abortion, of
taki
course.
taki moment, kiedy te
sometimes
dzieci w jakiś sposób o tym
comes a
się
moment when
dowiadują.
these children
I
learn
w
the
swojej
fact.
publikacji Philip Ney i Adele Rose,
Philip Ney and
to
Adele
była
Rose
dawna
in their
publikacja, bo w 1989 roku, ale zwracam na nią uwagę,
from
dlatego że
89,
stwierdzając, że
but I would like
stwierdzili
to
oni,
point
że na
to
depresję
this
po aborcji
this old
cierpi
paper. They
92%
suggested that
kobiet oraz
over
82%
82% of women
mężczyzn. To jest
and
bardzo duży
82%
procent.
of
Nie
men
wiem, czy
suffer
te badania
depression
później były w
after
jakiś
abortion.
sposób
No,
powtarzane,
if the
czy były
later
analizowane według tych
research
samych metod,
referred to
ale
it in
bo nie
any way,
znalazłam
whether this
nigdzie,
methodology
ale
was
być może, że tutaj
well,
warto by
whatever,
było również
but
poszukać
still,
trochę
the
w
data
tym
is quite
temacie.
striking, and I
No i
think it
jeszcze
might be
jedna
worth
rzecz,
it
bardzo
to
istotna, syndrom
at least
ocaleńca.
second glance on them.
Oczywiście
And
osoby,
the
która
survivor syndrome, the last thing I think
wzrastała
is also important.
w rodzinie z problemem aborcji i może doświadczać
family with the abortion problem
skutków tego wydarzenia. To jest rzecz
and might
zdecydowanie
experience the
chyba
effects
rzadsza,
thereof.
przynajmniej mniej omawiana w literaturze
I think, or
naukowej,
definitely
ale
less present in
trzeba
scientific
pamiętać
literature.
o tym, to jak
But still,
rozmawiam z pacjentkami, jak analizujemy ich
when I speak
problemy
with my patients,
stricte
when we
kliniczne,
analyze their
to
problems,
pojawia się taki,
clinical problems,
taki
strictly
temat,
speaking,
pojawia się takie zdanie, że
very
że
often
moja żona jest zimna
we notice the
emocjonalnie,
fact,
mój
it's
mąż
spoken
jest
that
zimny
my wife is so
emocjonalnie, nie
cold,
jesteśmy w
my
stanie się
husband is so
dogadać, dzieci
no,
dzieci również nasze
we can't relate to each other anymore.
są takie
Our kids are so distant.
wyizolowane i brakuje im najczęściej wtedy miłości i akceptacji.
And very often
Ja
they
nie
lack
chciałabym
in
mówić
self-esteem,
o stresie zespołu pourazowego, bo myślę, że że tutaj w tym gronie to bym się troszeczkę pokusiła o coś, na czym zdecydowanie słabo się znam. Natomiast trzeba pamiętać o tym i ja to zwracam uwagę na to pacjentkom, że osoby, które cierpią na PTSD, przechodzą 4 etapy tego procesu. Każdy z tych etapów jest inny, ale tutaj wracamy do problemu właśnie narkotyków, do problemu picia alkoholu i uciekania w ten sposób od problemów. Szczególnie w tej ostatniej fazie, czwartej, kiedy pojawia się depresja, kiedy jest bezradność, upokorzenie, a nawet dochodzi do próby samobójczej. Ja myślę, że tutaj na zakończenie chciałabym
sometimes it even comes to suicidal behaviors. Just to terminate.
Słowa Jana Pawła II w encyklice Ewangelium Vitae, bo my nigdy nie oceniamy kobiet, nie mamy prawa ich oceniać, dlaczego postępują tak, a nie inaczej, dlaczego się poddają aborcji, niezależnie od tego, jakie mamy doświadczenie, jakie mamy doświadczenie naukowe i czym dysponujemy. Ale proszę zwrócić uwagę na te słowa. Szczególną uwagę pragnę poświęcić wam, kobiety, które dopuściłyście się przerwania ciąży. Kościół wie, jak wiele czynników mogło wpłynąć na wasze decyzje i nie wątpię, że w wielu przypadkach była to decyzja bolesna, może nawet dramatyczna. Zapewne rana w waszych sercach jeszcze się nie zabliźniła. Tak jest, bo tak Państwo w tych badaniach swoich przedstawiacie. Nie ulegacie jednak zniechęceniu, nie tracicie nadziei. Starajcie się raczej zrozumieć to doświadczenie i zinterpretować je w prawdzie, a więc dalej badania naukowe, badania i szukanie prawdy. Z pokorą i ufnością otwórzcie się, jeżeli tego jeszcze nie uczyłyście, na pokutę. Odkryjcie, że nic nie jest jeszcze stracone, będziecie mogły poprosić o przebaczenie także swoje dziecko. Ono teraz żyje w Bogu. Wsparte radą i pomocą życzliwych wami kompetentnych osób będziecie mogły uczynić swoje bolesne świadectwo jednym z najbardziej wymownych argumentów w obronie prawa wszystkich do życia. Dziękuję.
And to protect life. among others.
I want to thank all the guests. Thank you very much for your presence and extremely relevant informations. I guess.